Here's what we're going to talk about relative to the changes that are happening in the profession and how you and I might adapt to them. Dental implants are the biggest change that's ever happened in my career. We'll hit them for a few minutes. Now every treatment plan that has a missing tooth or that's even orthodontically oriented has to have an observation of what is available in the dental implant arena. Here's some I've done, the 4 upper anteriors that are prep veneers. You see, and you can notice down on the lower I've placed some nanofill resin rather than veneers. That's one of my critiques of what's happening right now. We're seeing far too many veneers on teeth that didn't need them. Endodontics versus tooth extraction and implant placement. Look at these examples. One of the major reasons I see for CAD/CAM and its increase, as it is increasing extremely rapidly, is something many dentists have never thought about. The elements, the metals that we use in crowns are the same elements that cause eczema and earring areas, rings that can't be worn, and you're looking at a clinical example right there. You don't want to hear this portion. We're seeing the laboratory industry die. There are now 12,000 laboratories in America. I predict there will be 6,000 by just a few years. There are 6 characteristics of informed consent. You may not know them, but you need to. One of them is, what are the alternatives for care? What are the advantages of each? What are the disadvantages of each? What are the costs of each? What are the risks of each? And what would happen if I don't do anything? I've just given you 6 things. And if each one of those is discussed by the dentist or his or her staff with the patient, they have satisfied the characteristics of informed consent. Legal